Heart disease is the leading cause of death in the United States, so we're discussing how to prevent it. Our guest is Dr. Zaid Amin. He's an interventional cardiologist. This is the Beebe Healthcare Podcast. Thanks so much for joining us. I'm Joey Waller. Hi, Dr. Amin. Welcome.
Hi, Joey.
Great to have you aboard. We appreciate the time. First, what in a nutshell is the big picture of what your work involves? How do you describe what you do as an interventional cardiologist?
So, as an interventional cardiologist, my work focus on diagnosing, treating, and preventing heart and vascular disease. So, basically, this includes everything from managing risk factors like high blood pressure, high cholesterol, to performing procedures like cardiac catheterization and placing stents. So I see I see patients across the spectrum, those patients with early risk factors for heart and vascular disease, and those presenting with acute heart attacks that require timely intervention.
So what's the main thing that sets interventional cardiology apart from general cardiology?
So basically, with general cardiology, the main focus is on diagnosing and long-term medical management. However, in interventional cardiology, we have the procedural component, which basically enable us to intervene in acute conditions. For example, patients presenting with heart attacks. So we go in with small catheters. We basically visualize the blocked artery, and we go ahead and open up the blocked artery in a timely manner. So basically, I would say what sets it apart is the procedural component.
Taking a quick step back here in terms of background, coronary and vascular disease are your major focuses. Why did you move in that direction in your career?
So basically, I'm passionate about this field because, to start with, heart and vascular diseases are one of the leading causes of death worldwide. But although they are one of the most common leading causes of death, however, they are often highly treatable and often preventable. So that's why I'm passionate about this field, because early detection and early treatment can basically have good long-term outcomes for the patients.
And I'm going to ask you more about that in just a moment. But first, also in terms of background, is there a key experience, maybe a key particular moment, doctor, in your training that really helped shape your approach to the way you practice nowadays?
So yeah, basically during my interventional training, we were involved in managing a lot of patients with acute heart attacks. And this emphasized the importance of rapid decision making, and also teamwork, and also staying calm under pressure. And it also emphasized the importance of how timely intervention can be in fact impactful in these patients in saving the heart muscle and having good long-term outcomes.
Doctor, you mentioned prevention a moment ago. How would you say that fits into your overall work, and what types of patients do you see early to facilitate that?
Prevention is a cornerstone of what we do. So our focus is on treating patients with risk factors such as high blood pressure, high cholesterol, diabetes. So we try to basically, with these patients, try to detect heart disease early, and we try to be aggressive in controlling their risk factors. Also, an important part of prevention is lifestyle modifications, including regular exercise, maintaining a healthy weight, also having a heart healthy diet, and in addition, avoiding tobacco. So that's what we always try to, we closely with our patients to try to tackle these risk factors and being aggressive on managing them early on in order to prevent heart and vascular disease.
And doctor, speaking of those lifestyle changes, you mentioned diet, smoking, exercise, three of the biggies, probably the three biggest, right? Just one or two simple tips you have if people want to just start out by doing something manageable to head down the road to a healthier heart. What would you suggest?
So basically, as you were talking, these are like, simple concepts, basically, like, regular exercise, heart healthy diet, and like, maintaining healthy weight. But the main thing is consistency. Consistency has the biggest impact. So as we said, these are simple, like, simple, like, things that we can do, but we need to be consistent with exercise, trying to eat a heart healthy diet, maintaining a healthy weight, and these can, even like small changes, can have a big impact down the road.
Absolutely. How about your advice for patients balancing heart treatment, vascular treatment with quality of life? How do you get the best of both worlds there?
Yeah. So, of course, in general, like, even so, this is a big concept in medicine in general, like, quality of balancing quality of life with treatment. So, always, like, when we work with our patients, we try to individualize the treatment plans for our patients, trying to of course, always understand what are the patient goals of care, what are the patient lifestyle and preferences, and try to incorporate that into the treatment plan. And of course, this is very important because we need our patients, when we work closely with our patients, we need them to be compliant with our plan and our treatment. But if we don't understand, like, the patient background, the patient goals, the patient preferences, it would be difficult to achieve that.
How about one thing patients most often misunderstand about their vascular health? Is there a common misconception you can clear up for us right here?
So a big misconception basically about like heart disease is that they may present with it has to present with severe symptoms like severe chest pain, but actually this is not true, because like even in some patient populations like diabetics and women, they may present with subtle symptoms, and even like, in some patients they present with, like, we discover them later on with when they have very minimal or no symptoms at all. So that's why we always tell our patients to get evaluated early, even if they have mild symptoms, and not get it ignored, especially if the symptoms are new or getting worse.
Switching gears a bit, what was it most of all that first drew you to Beebe?
So basically, what drew me to Beebe is that the ability to provide high quality care and cardiovascular care to the within the community. I think like with Beebe, we are able. Patients doesn't have to travel anywhere. Like, we provide all cardiovascular services here within the community, which is a great thing. And I think that was a major thing that drew me to working here in Beebe.
What would you say makes the Cardiovascular Institute at Beebe so unique? What do you really hang your hat on, you and yours?
So basically, I think with the Cardiovascular Institute, it's basically a very, I think, ambitious project. At this time, like, we're in the building process, and it's going to be like, different specialties within the cardiology, and we're going to be working closely with the cardiothoracic surgery team. And I think that's a great thing, because we'll be able to provide, again, like high quality care and advanced cardiovascular therapies to our patients here within the community.
Let me ask you a few things personally speaking. Where are you from originally?
So I'm originally from Jordan. So I did my medical school back there. I completed my training back there at home, and then I worked for a few years back home, and then I moved to the U.S. where I did my internal medicine residency training and cardiology training in New Jersey. And then following that, I moved to Phoenix, Arizona for my interventional cardiology training.
And in fact, one of your residencies back home was at the King Hussein Cancer Center in Jordan. How cool is that? Not many get to study medicine at a facility named for a king, right?
Yeah, so that was like actually after I graduated from my medical school, I did actually some internal medicine training there. So yeah, it is it's actually a tertiary cancer center. And yeah, I had a great experience there. Yeah.
And then I understand you've played some soccer throughout your life. So tell us about that and your other interests outside of work. What do you enjoy about the coastal community?
Yeah, soccer. I'm a big soccer fan. Like me and my family are really enjoying the community here, and I think outside of work, I like enjoying time with my family, with my kids. Also, I'm trying to be active, and we're enjoying here, our stay in Delaware, and I think it's a great place for the family and the kids. Yeah.
Absolutely. And then in summary here, Doctor, how about one thing you hope those joining us feel empowered to do for their heart and vascular health going forward? What's job one?
So basically, as we talked, prevention is very important. I would say I would urge patients to be proactive about their heart and vascular health. As we said, don't ignore your symptoms, even if you have mild symptoms. I would urge you to get evaluated early, and especially if you have risk factors like high blood pressure, high cholesterol, if you have any history of smoking or also a strong family history of heart disease, I would recommend to get evaluated early.
Absolutely. Well, folks, we trust you're now more familiar with heart and vascular health. Dr. Amin, a pleasure. Keep up all your great work, and thanks so much again.
Thank you. Thank you for having me.
Absolutely. And to make an appointment with Beebe Cardiology, please call 302-644-4282. Now, if you found this podcast helpful, please do share it on your social media. And thanks so much again for being part of the Beebe Healthcare Podcast.